Hi guys, I just wanted to drop in and answer last week's questions. So the questions we got asked last week were what exercises would we recommend and what treatments would we recommend for horses and riders with back pain. So we don't treat humans, but if you do have back pain as a rider, make sure you do check with your doctor and your physio to make sure that you've got that treated, because that will 100% affect your horse's way of going, and that is going to lead to their back pain. Just the same as if you feel like when you ride you're unbalanced, so you put more weight in your right or your left, that's going to affect how your horse carries you and then affect how their back works, and therefore can lead them to get more back pain because you're putting more pressure on one side of their back than you are on the other. Hi Anne, thank you for joining us. If you've got any more questions, do just bob them in the comments and I'll answer them as well. So moving on to our horse's back pain. There's a few signs that we can look out for with back pain in horses. They can be quite good at disguising it and pretending that they're all fine when in reality they're not. So you want to be looking out for behavioural changes. So if your horse suddenly becomes very spooky or won't strike off on the correct canter lead, any changes in behaviour like that, or a reluctance to do certain things. So a lot of horses with back pain will struggle to eat from the ground, and they'll be used to eating from hay nets, and they'll build up a lot of tension in their back from doing that. So the best thing we can do is to feed them from the ground, but initially they will find that quite difficult to reach down and stretch down to the ground. So you might notice that as well when you're riding, that your horse is reluctant to go into that nice long and low posture that we're after, and they'll tend to be going around more like a bit of a giraffe, which is not what we're aiming for. I think we can all agree there. But that's what you might find if they're suffering from a bit of back pain. So I would recommend if it's an acute onset type thing, so it's only just started happening, make sure you do get the vet to check them out, make sure it's nothing sinister going on, because you can get changes in the vertebrae of the back or changes in the sacroiliac joint, so that's where the spine meets the pelvis, and there's a lot of force put through that joint because it takes all the power from the hind end up and through into the back to get your horse moving forward, and it's only held together by a few ligaments, so it's a place where a lot of injuries occur. So do make sure that your horse has seen the vet and that nothing like that has occurred, and then make sure that you've had your saddle checked, because if your saddle doesn't fit, it's 100% going to be causing back pain, because it's going to be putting uneven pressure down your horse's back, the same as like if we sit wonkily, that's also putting uneven pressure down our horse's back. So if we all work together with the vet, your riding instructor to get you more balanced, your saddle fitter to make sure that the saddle's correctly fitted, and then with your physio to treat the back pain that is occurring at the present time. So like I've mentioned, there is a number of reasons why back pain might be occurring, and the treatment will depend on what the cause is. But broadly, without going into too many specifics, unless you've got a specific cause of back pain you'd like me to discuss, then just let me know. But broadly, we would aim to reduce tension in the back muscles. So there's a set of muscles that run either side of the horse's spine, and they're called the paraspinal muscles. And those are the most commonly effective ones. And those, so say we've got an incorrectly fitting saddle, those are going to be compressed in certain areas. So rather than being the nice muscle that they are, they're going to have a little dip in them. And that's because the muscles have been pushed together and have become very tense and very hard. So this is something you'll feel as you feel along your horse's back. There might be points that feel harder than other points, and those are the bits where your horse is holding tension. So what they're doing there is tensing the muscles up rather than them being nice and relaxed. You might also get spasms within the back, so that's you can do like run your hand along their back, and if they start twitching, not like they would if they've got a fly on them, but the muscle starts twitching, that's like a muscle spasm, and that's a sign that there is pain in the back. So if we came across those muscle spasms, which we call trigger points, we most commonly treat those with laser therapy and pulse electromagnetic therapy. So what those do is they stop the pain signals being sent to the brain, so your horse will feel less pain, and once they feel less pain, we can use massage and therapeutic exercises, such as stretching, so those would be like your carrot stretches, to lengthen those muscles and reduce what initially caused the pain, that shortening of the muscle. So it really is a multimodal approach. So we're going to be working with our instructor, our vet, our saddle fitter and our physio to make sure that all of these things are in place so that we can fully reduce the pain that's already there, but also stop it occurring again, because there's no point treating the pain for it to come back a few weeks later. So it is really important that we do all of those things and try and keep on top of them all and make sure that we eliminate the cause of the pain and not just treat the pain that's there, because it'll just keep coming back. So once we've addressed the underlying cause, we've found out why our horse has got a sore back and why it's in pain, and we've identified where that soreness is and we've treated it, so our horse isn't in pain anymore. Then what we can do is move on to some exercises to help strengthen their core muscles. So their core muscles are equivalent to our abdominal muscles. So they're everything that keeps them balanced, keeps them held together, and a lot of riders focus on the top line, so getting that nice top line, but you can't have a nice top line if you don't have core muscles. So we always focus on the core muscles first, because if we build up a strong core, our top line will naturally follow. So if we've got pain in the back, that's because the back is being overworked. Now that might be because we've been sat wonkily and we've been hurting our horses unintentionally by just being wonky, or it might be that they've got an underlying cause. But in either case, increasing the core strength of our horses makes it easier for them to carry us. So if we can increase that core strength, the back is not having to work as hard to carry us as a rider, because the core is doing more of that work than the back. So it's just like us when we're, that good old image of someone picking up a cardboard box and you're meant to bend your knees and not use your back. And it's exactly the same for our horses. If we increase their core strength and increase that muscle mass there and increase the strength that they've got, their back isn't having to work as hard, so it's less likely to become injured. So there's a few different core exercises that we've got in the horses, depending on what level you're at. I'll put a link down in the comments to a handout on core exercises if you want them in more detail. But briefly, we've got ab lifts, tail pulls, pelvic rounding exercises, baited stretches, cavaletti or pole work, anything that challenges our horse's balance. So we can have wither rocks, so they're basically just pushing your horse off balance. But in doing that, we are engaging our horse's core so that they strengthen those muscles. So every time our horse is pushed off balance, the muscles are being strengthened. And that is going to help us to then increase that top line and reduce the occurrence of pain in the back. So I hope you've found that helpful. If you do have any other questions, or if you've got any questions you want us answering next week, I'll put a post out for you to post them there for anyone who's watching this on the replay. So I'll see you next week, guys. Bye!